Yeah, yeah.
Thank you, sir. So I will start the onboarding process with my presentation. So thank you very much, everybody, for joining in. The numbers are increasing. The focus today in pharmacy has become what is called as pharmaceutical care, which is essentially being patient-centric and doing a pharmacy practice so that there is improvement in the health. So we can prevent the disease, monitor, initiate, and modify the medication use along with other healthcare workers like the doctors, so that we can assure the best out of the drug therapy. Today, pharmaceutical care, which has come to the forefront, is responsible for providing drug therapy which achieves definite outcomes that improves the patient's quality of life. So there is an encouragement for safe and appropriate use of medication. Thereby, we get better therapeutic outcomes. So medication management review, which a pharmacist does, is one example of how a pharmaceutical care delivery is done. So basically, the pharmacist reviews what medications are being given and then gives a counseling, particularly to the elderly or the subject who is innocuous or innocent to the pharmacy world, and explains how the medicines can be used for better health. So home medication reviews are a subtype of this medication review in which the patients are interviewed by the health professional in their home. That is the typical type of home medication review. Today, this home medication review has increased. The only reason is that there could be some sort of a COVID-19 pandemic challenge, and these elderly subjects would require counseling not in the pharmacy alone, but also inside the home of that individual. And we know counseling is basically a process of interaction where a specialized professional and a client will be talking to each other, and the client gets clarity to make the right decision making process. So it is basically a client centric process to ensure that there is the curing of the disease and the patient's symptomatology is avoided or eliminated or reduced. So these are the reasons why pharmaceutical care home medication review is being done. And I am Sunil Chuplunkar, who is your co-speaker and moderator for today's evening. And I will take a different take on pharmaceutical care practice by focusing on some interesting cartoons so that I'll make it a little light. So here is a pharmacist who is encountering an elderly subject, and then the counseling session has begun. Very interesting situations will develop. Like, for example, in this particular situation, you will see that the subject is saying, people need a sense of community or belonging, and we have developed just the drug to give it to them. So basically, what pharmaceutical companies are doing in this case is that they are trying to improve the belongingness of the patient towards the community. So they are inventing a drug for that. That's what the cartoon is trying to elaborate. Here is another interesting cartoon which says that, listen, with this drug, the illness lasts for about 7 days. But with these drugs, it will be over for a week. So basically, he's playing on the word 7 and 1 week. It is the same thing. But what this cartoonist intends to say is that patients need to be counseled in a way that they require for their understanding. For some patients, it would be 7 days. For some patients, you say 1 week. For some patients, you say a decade. He will not understand. So this is the reason why we need to counsel basically in the language of the patient. Now, here is a very interesting point in which the patient is asking, why are you prescribing me biosimilar? Why can't you prescribe bio-exact? No, that's an interesting point, isn't it? Because for a layman or a patient, you will think, why a doctor is prescribing a biosimilar drug? Biosimilar means not the actual drug. That's a correct thing that she is asking. So that is what she is saying. Why are you prescribing a biosimilar? Why don't you prescribe something bio-exact? So here what we have to understand as pharmacists is that we take certain terminologies within our pharmaceutical circle for granted, but the same meaning will not be taken for granted by the patient. So we need to explain when we are talking about these concepts to various patients. Now here there is another interesting cartoon which says, now listen, this is the latest drug in the market, Mrs. Watts. It will benefit me, it will benefit the pharmaceutical company, and it might even benefit you. So that is, they are pulling the leg of pharmaceutical marketeers and the pharmacists, where they are saying that the cartoonist is saying most of the drugs seem to be invented for the benefit of the pharmaceutical company, but nobody is actually thinking of patient-centric medication and patient-centric therapy. Well, that can be true. So we need to understand that. And here the doctor is saying, I'm going to switch you to a new medication that does more advertising. So what he's trying to say is that the company which is promoting more of one particular brand, he's switching over to that. So it means pharmaceutical companies have got a great sway on the prescription flow and pharmacist behavior. Today, India is a leader in generics, but big pharma, which is there across the world, is now wondering if so much of business is getting lost to affordable generic medications, what about them? So here the cartoonist is saying, big pharma lobbies hard to end India's distribution of affordable generic drugs. This is just a take on how money power plays and money muscle is very important in the world of business. So here the patient is asked by the pharmacist, what are you allergic to? And then the patient says, my wife. Well, it's no laughing matter. Actually, there was a case where a pharmacist encountered a patient who always used to complain of being allergic to his wife. Then they found out that the scent, the perfume which was being used by the wife, used to cause allergic rhinitis to the patient. So these sort of quixotic situations do crop up in the pharmacies. Now, ladies and gentlemen, it is time for the pharma quiz. I request everybody to participate. I am quickly asking this question. A lady patient is on anti-TB drugs, highlighted as anti-TB drugs and anti-diabetic drugs, and at some time she complains of fatigue and gastritis. What do you think is the reason for that problem in the lady patient? Please type your answer. There is a gift awaiting for those people who give fastest finger first answer, as well as more number of accurate answers. The question is, a lady patient is on anti-TB drugs and anti-diabetic drugs, but she is complaining of fatigue and gastritis. So why do you think she is complaining? Please write down the answer in the chat box. Please, I'm waiting for the reply. Quickly type in. The lady patient is complaining of some fatigue and gastritis. What do you think is the reason? Please type quickly. The prize is awaiting you. Can I have the answers? Not a single answer has come. The prize I will keep. Okay, Mahendra is saying drug interaction. No. You are somewhere in the right track, but it is not drug interaction. Any other? I will give you a clue. It is anti-TB drugs. The clue is anti-TB drugs. Try to think what is the problem. It is not drug interaction. It has something to do with anti-TB drug. Drug incompatibility. No, Nishgandha. No, not that. Anybody else? Please give the correct reply. What do you think that the anti-TB drug will do? Yes. Which is that TB drug side effect? What is it? Rashmin, you are close. Please answer it correctly. That anti-TB drug is causing something. No, it's not drug. No, it's not incompatibility, not drug resistance. Change your line of thinking. What is the side effect? Yes, rifampicin. What is it? It acts not as an acid. What is the side effect? ADR. Yes. What is the ADR? Just tell me. What is the ADR? Please, not a single person has answered just now. Everybody is close to the answer. Let us see who will. What is the ADR of anti-TB drugs? Anti-TB drug absorption which is causing stomach bloating. No, Manisha, you are near, but somewhere one particular organ is involved. Which is that organ? Tuberculosis also affects diabetes. No, I will not accept that. One particular organ is affected. Which is that organ? Juhi, anti-drug resistant. Ramesh, no. Which is the organ which is affected by anti-TB drug? I'm almost giving out the answer. Not lungs. Liver damage. Yes, Dr. K.K. Shivkumar, you have given the correct answer. Liver damage. We'll go to the next question. Let us see. Dr. Viresh, you are slightly late. Liver is your correct answer, but Dr. Shivkumar takes the first. Next question, please answer. A patient is on antihypertensive drug therapy, and after 2 to 3 days, he complains of getting dizziness. after getting up from sleeping position. Please see this. When he is in the lying down position and then he suddenly gets up, he starts getting dizziness. From lying down position to sitting up position or standing up, he gets dizziness. What is that BP problem? Please write down in your chat box. A patient is taking a particular anti hypertensive. Yes, Rashmin, you are correct. It is postural hypertension. You have got two correct. Let us watch. Rashmin has got it correct. It is postural hypertension. Katta is also correct. It is orthostatic hypertension. Next question. A patient comes to a pharmacist and insists that she wants a superior drug called acetaminophen for headache relief and not the paracetamol given by the pharmacist. So what is the problem here? Pharmacist is giving paracetamol, but she is saying, I don't want paracetamol, I want acetaminophen for headache relief. What is the problem here? Please write down what is the problem here. The patient is saying, I want acetaminophen. Pharmacist has given paracetamol. So what is the problem here? Okay, Viresh, you have Pratap, you have got it correct. Both are the same. No, it is not brand name different. Both are the same. Generic name, generic. Both are the same. Okay, let us see who will give the correct answer to the next question. A chronic alcoholic patient is prescribed diclofenac. A chronic alcoholic patient is prescribed diclofenac. So what is the potential problem here? What is the potential problem here? Somebody has to answer this. A chronic alcoholic patient is prescribed diclofenac. So what is the potential problem? No, alcoholic patient. Okay, both are analgesics. Alcohol, I will not accept is the analgesic. Okay, one good answer is ulcer, but I'm looking for one more answer. Yes, diclofenac, what it will cause? Yes, Herat is good. It causes the liver damage. Liver damage is correct answer. It's become difficult for me to choose the correct person. Okay, gastric problem, etc. But I didn't want that. I wanted the other problem, and that is the liver problem. Yes, Shaib Marin is correct that it is the liver issue that is the tension when diclofenac is given. Liver damage. Very good, very good. Last question. When is dexamethasone or IV methyl prednisolone prescribed to a COVID-19 patient? Last question. When is dexamethasone or IV methyl prednisolone prescribed to a COVID-19 patient? When will it be prescribed? Try to give me the correct answer. When will a doctor prescribe dexamethasone or IV methyl prednisolone to a COVID-19 patient? When? Yes, shortness of breath is good answer. Anybody else? Inflammation condition, very good answer. Anybody else? Moderate, okay. Then stage 2, okay. Okay, right. I think Dr. Kaushik is also watching here. Very good answers have come from everybody. But what I am noticing here is a gentleman by name Viresh Pratap. Have you noticed that Dr. Kaushik, he has answered 2 questions correctly. Remaining people have answered one. He has answered 3 questions correctly. Okay, so today's winner is Viresh Pratap. Viresh, you'll have to send your address and phone number to this email ID, which I am just typing, and we will courier the gift to you. Thank you very much for participating, everybody. We are not only looking for the number of questions which have been answered, we are also looking for the fastest finger first. So I think there is a mistake in what I have typed. I will just correct it. It is, one second, I have typed it. Okay, I'll type it again. Let me proceed on to the next point. So Kaushik can type my email ID if he is free. So as I was saying, we are now looking at another cartoon. The patients know more about their diseases than me. So I must get higher modem, higher speed internet access than them. So today what is happening? Everybody is looking into the internet and then going towards the doctor, answering the questions, etc. So Dr. Google has become very important. There is another interesting cartoon here which will reflect the current medical situation also. Fortunately, the treatment will be relatively inexpensive since you have the generic form of the disease. So he is just pulling the leg because generic has become affordable today. So a doctor is telling him that there is a generic form of a disease. And here a capsule is telling to the tablet, or a tablet is telling to the capsule, honey, go and talk to him. He just found out he is a placebo. So placebo medicines are also a very important point, and placebos are also marketed. Like, for example, in this cartoon, you can see, yes, we carry placebos, but you will need a fake prescription. So he's pulling the leg of the patient, but actually speaking, placebos are also sold because they have seen that placebo effect also works, and placebos are also sold in the market. Everyone agrees to reduce the healthcare, and here the patient is telling to the doctor, I can't afford the diagnosis, doctor, whatever you have told me, it is too costly, give me a cheaper diagnosis. Here the pharmacist is literally threatening the patient, your money or your life. He is pointing to the medicine, pointing out how costly medicines have become. Hypochondriac is a person who does not, who likes to always take a lot of medications. He feels he is very sick. So he is a kind of a sickness oriented person. So he is patronized to a great extent by the pharma industry. And even there are hypochondriac anonymous groups to try and overcome that problem. So pharmacy, here you can see, is selling the opioid, and then he's telling the patient, you come next week and next week and next week and next week, because it is a habit forming drug. You may be knowing John Kapoor, in the big time pharma company owner in US, has got arrested for over marketing the opioid drugs. So these are all interesting cartoons. Here you can see, because of the current problem of the film industry, marijuana is still illegal, but opioids are half for another 40 minutes. So he's trying to say that you can buy an opioid. Why do you want to go for a marijuana? I mean, this is just another side of the pharmacy story. So try to understand that as pharmacists, we'll have to take a lot of challenging situations into our stride. Here is an interesting point. Heavens, no, no. One can actually read. Nobody can read a doctor's handwriting. We just take the computer and assign a drug based on your name and birth sign. They're just pulling a leg here of the doctor's handwriting. Eye test for pharmacists. Can you see here how actually the scribbling has been done? So this is pulling the leg of how it's difficult to read for the pharmacist, the different types of prescriptions that he encounters. So laughter is a very important behavior, and inducing laughter is possible either as a positive laughter, embarrassment laughter, surprise laughter, confusion laughter. So laughter is a very important, you can say, therapy also, and at the same time a required thing, because laughter, which is seen in both animals as well as human beings, is responsible for a feel good factor, and conversations tend to last longer. So if you are talking with a patient as a pharmacist, or if you are talking to another pharmacist, try to bring in laughter into the conversation. That will improve the interactions, the bonding improves, and also the internal motivation, and promotes the tolerance. So laughing is also good for the soul. Even the dogs are known to be laughter. But here I'm just giving you an unusual picture. Laughter that triggered a war. Lady Draupadi in Mahabharata, she laughed at the wrong time when Duryodhana fell into the pond, which he thought is not a pond but only an illusion. She laughed, and it triggered off Mahabharata war. And when Bhishma was dying, again at that time, Draupadi laughed, and he asked, why are you laughing? Everybody was shocked. He is dying, and she is laughing. That time she said, I'm laughing at your state. And you laughed, and everybody was laughing at me when Draupadi Haran was happening in the palace of Duryodhan. So these are all interesting concepts of laughter. And another very, very interesting concept to all of you is that laughter can improve the romantic happiness and sexuality. In a study of Journal of Research in Personality, they have said that a person with a sense of humor and enjoys a laugh will have more demand as a sexual and life partner. And usually, relationships where there is a lot of laughter between the two partners, their contentment level is much more higher. And women are reported to say they are more satisfied in their relationship and attracted to their partners if there is a lot of laugh. So laugh and romance, they go together, and that contributes to a good relationship. Humor is a signal of intelligence and not just starting of the relationship. So laughter causes the dilatation of the inner blood vessels, and lot of endorphins, enkephalins, and nitric oxide production is there, and reduction in the cortisol and epinephrine happens. So laughter basically makes a person feel happier, immunity boosts. And in a 2000 study in patients with heart disease, it was seen that 40% less laughter is seen in the individual with heart disease. So which means if a person is not laughing, it probably is contributing due to this heart disease. Now, Tenali Ramakrishna, you might have heard of this jester and an important courtier in Vijayanagar Empire. He was appointed mainly to create laughter, wit, and wisdom. That is the importance which is given. We also remember Charlie Chaplin, Laurel and Hardy, and also Terence Hill and Bud Spencer, who created so much of laughter for all of us. But my most favorite laughter, and I think Manoj is laughing, and that is Mogambo Kushua. So that is my favorite laughter. There are today laughter clubs you can join in and indulge in fake laughing, because that's going to improve your endorphin level. And when you laugh, automatically a Duchenne smile, which is an authentic smile, happens. And you look better when you smile. It is seen that when you smile, the chance of getting depressed reduces. It's like a feel-good party for the brain, and your neural messaging improves. We all like when children smile, don't we? And it is seen that children smile 400 times a day. Happy people smile 40 to 50 times a day. But average people like you and me probably smile only 20 times a day. No wonder we are so depressed individuals. There is a facial feedback hypothesis. It means if you smile, you get good brain happy chemicals. And if there are happy chemicals, again you smile. So it's a two-way street. So why am I talking about all this? It is the dentist and the pharmacist who makes the patient smile, laugh, and helps create success. Especially the dentist is responsible for creating the smile, and he helps you take on the world confidently. Group Pharmaceuticals is partnering with dentists and pharmacists to create a world full of healthy smiles and laughter. We offer excellent products like Shy XT, Shy NM, which are all bioactive glass toothpastes, Omnident, which is for bleeding gums, and Fresh Chlor is an excellent type of a mouthwash and throat gargle with antiviral action. Avoid contact greetings, ladies and gentlemen, and consult your dentist and pharmacist. He will change your destiny by boosting your smile value and confidence. Don't you agree that smile is important? Yes, thank you very much. And we have a very, very happy and a smiling individual in Dr. Girish Tunga sir here. Thank you very, very much, sir, for coming. Now you are on. I'm presenting your PPT slides. Please unmute and continue the talk, sir.
Good evening, all. Yeah, this is one of the favorite topic of mine, home medication review, which is a common problem we are facing in a daily our clinical activities. When a patient comes to us and discussing regarding the management aspects or drugs, as you have seen in this thing, there will be a bunch of tablets, and he is worried which to take, when to take, why to take. Most of the time, what is happening is the common problem, what I observed in every part, one patient who is particularly in the geriatric age or in the elderly patients, they have a multiple complaints, and he will has to consult with a multiple doctors. So during that time, what is happening, the drugs prescribed by him particularly is in a such a way, there will be no communication between each physicians. So it is our common practice actually when our students are sitting in the patient counseling. There is one area we have where one patient will bring 6 prescriptions. In that, you can't believe there is 3 prescriptions have a repeated proton pump inhibitor. She is a lady who was working earlier in a Kuwait, and she have a multiple problems, particularly associated with the gastric problems. She is having a rheumatoid arthritis. She is having a blood pressure. And with this, she is bringing 3 big covers, and she is telling our students, help us to sort it out so that how I will take. So probably that when we are sitting there and we are checking that one, In that, as I told you, most of the time, this proton pump inhibitors, or either it will be in terms of H2 blockers, they are repeating. So where is the exactly problem lies? Problem lies because when this particularly there is a no, even if it is a single hospital and they are communicating with a single doctor, definitely the file will be same. Definitely they are going to look. But when you are visiting into a different sector, we don't have any type of electronic record base where you can trace the patients. So only thing today also it is working based on the paper system. Suppose a patient coming here or any hospital, he will visit another 2 doctors. Moreover, there is also one of the problem what we observed is patients are not only following the allopathic medications, they will also follow the even some complementary alternative systems. So the problem lies where? Either patients are fails to communicate what they are taking, or either doctors are not able to take the proper history because of the lack of time. So with this, I'm going to start with this topic, home medication review. Exactly the home medication review means what? Who are eligible to do the thing? Definitely, it is a concept originated in the Australia. Everyone telling that actually Australia is one of the country which is identified very early stages of the recognition. But I am telling more than Australia, India is the one which is really need of that one. Still also, as sir told, Google is a better player. Now every patient knows everything. You can't ask tomorrow to body, you can ask atenolol, he will counsel us back. Everything he knows. But apart from that one, there is something called as a common, what we can call as knowledge, which is even computers also not can provide. So everyone knows about, if you say, he told that just on this one, he told acetaminophen and paracetamol. If you definitely, it is both are generic name, but how the patient will know? Patient may not be knowing that one. So when he able to get a particular prescription, he able to read the brand name, he will type, he will tell, oh, this is given for the BP. But he don't know what is the part of the drug interaction. He don't know what is the side effects. He don't know what to take, how to take. So there are a lot of issues, especially associated with the medicines, particularly when a patient is having associated with the polypharmacy. Yes, this is a really challenging area and there is a lot of scope is there. And I am looking in the last of 10 years of my professional this thing, I have not a single person to concentrate that area where really there is a need of such type of what we can call it as a huge opportunities for the any type of job orientations or any type of such types of the startups. Yeah, even there is a lot of legal issues are there. There is a lot of this thing is there, but still counseling is a good aspect, which is definitely help many people for getting the, what we can call it as a side effects and other things. Anyhow, coming to the main topic, as you know that home medication review, I'm not going to discuss the definitions. Actually, I want to highlight what is it and what is its need and how it is conducted. Most of the informations are definitely it is available on the net, but still there are certain common things are there that is everyone has to understand what is it. So it is mainly patient focused. When you talk it is a home medication review, it is patient focused. Our aim is to not to prove we are superior than the general practitioner or we are superior than the doctors. Our main aim is to just to, what we can say is to prove that patient should be healthy at the end of the treatment and his quality of life should be improved. So it is generally working in the community settings where the quality of enhancing the medication use will be promoted. So generally it is a service designed to assist the consumer to cure, helping in better cure and having the better quality of life, minimizing the minimum most of the medication related problems. So most of the countries like Australia and other things, this HMR is generally done by the pharmacist. So how the system works there is, whenever the prescription has been made by the general practitioner, he will refer to the patient and a pharmacist, and pharmacist will go to the homes, and they will generally take care of the all the related medical related problems of the patient and other drugs and other things here, and then they will prepare a plan which is required for the patient for the administration of the medication, and then they will discuss with that, and thereby both plan will be prepared for the patient, and later the pharmacist duty to implement that thing. So this medication, home medication review or medication review, most of the done by the clinical pharmacist. It should be either M.Pharm or Master of Pharmacy or the doctorate pharmacy, who will have a brief, broad knowledge about the diseases and adverse drug reactions. He will generally carry out the what we can call it as a home medication review. Then question comes, why pharmacist? As I told, pharmacist has a medicine domain, and as well as he has a clinical knowledge. Apart from that one, what good quality of the pharmacist have? If you see, pharmacist is a leader. Yes, he never do like a boss. He is always the leader, and leadership makes him particularly provide the such type of a noble services. Next, he knows to mingle with his what we can call it as there is a good association between all the discipline, including either it will be a nursing, either it will be a general practitioner, even all the patients. Many times what I observed when we are discussing the patients, whatever he is not telling to doctor, he will discuss with us. A strange thing, even still I am telling when I was visiting to a KMC hospital, Manipal. So what was happening was, they have put him a diabetic patient, they have put him on antidiabetic drug. So initial days, what is happening, his sugar level was around 400. So suddenly they have started with the insulin, and they have started with one oral hypoglycemic. Patient sugar level was normal for 3 to 4 days. They are planning to discharge. So what happened during the process of the 5th day, he started developing what we can call it as a hypoglycemic events. Doctor has surprised, and suddenly when stabilized for a 3 to 4 days, how he developed such problems. So there was a rounds. During the rounds, they have asked one of our students, can you help it out to do the things? So generally what is happening, drugs will be given by the nurses. After proper inquiry only they will give. After the food they will give. So all the precaution has to be taken. In between there is a hypoglycemic event was observed. So it is not for a single day, even next day also it was observed. So what we have done is, I went with my team, especially what I am teaching them, the bedside teaching. That time I just asked them, you are taking your medications from the hospitals, still you are getting this one. Apart from that one, you are taking any other medication earlier. Suddenly that patient relative told, 4 days before there was we have admitted, but when we are coming to the hospital, we didn't bring our Ayurvedic medication. My sister went and he brought. From yesterday onwards, we have started giving. This story, Papa, the doctors don't know. So when we looking that one, it is an anti-diabetic drug. So it is a complementary alternative medicine plus something allopathy you are taking. Whatever the way of what we can call it as your route of medicine, but it is what is happening is, particularly whatever route you are taking, the action is finally the hypoglycemia only. So generally whenever you are taking the multiple system of this one, when the physician definitely unaware about that one, what is happening, this leads to definitely a misleading of a physician for treating a better options. So in this condition, what is happening is, particularly when we are looking for such type of medication challenges, it will be really a challenge to any physician for particularly managing the situation. So this is why it is happening, because of the lack of information provided by the physician, or lack of what we can call it as a history taken by the physician, or information provided by the patients. So this is only happening in the hospital setting. Come to the situation in the community. What all things are happening? Particularly, there is a lot of issues are happening, particularly when people on large types of medications. So particularly potential indications for the HMR, particularly for which patients then this home medication review is needed. Usually patients who are taking more than 5 or more regular medications. Patients are having a multiple, what we can call as a consultants. There is a particularly significant changes has been made with respect to the medical treatment for the regimen of last 3 months. Medication of the very narrow therapeutic index. What is meant by this narrow therapeutic index? Narrow therapeutic index of the drugs, particularly which is having a high risk medications. Example, digoxin. Example, methotrexates. So whenever there is a such type of drugs on patient, you require a special counseling, because most of the time what is happening, the medications what they are taking, it will mainly influences with the what we can call it as a outcome or quality of the life. Example I will give you. You all know methotrexate, correct? Methotrexate is one of the wonderful drug which is used for rheumatoid arthritis. So what is happening? A folic acid is a drug which is prescribed along with the methotrexate. So why it is prescribed? Because it will prevent the neuralgia or peripheral neuropathy. So what is happening when you take the two drugs together, folic acid and methotrexate, definitely there is a variation in the absorption of the both drug will happen. Means the absorption of the methotrexate as well as the folic acid will be affected. So generally, if the patient is taking two drugs together, then definitely there is a variation in the what we can call it as outcome of the treatment we will observe, because patient may not having able to get the sufficient relief of the pain, or he may develop the some of the side effects. So these are the common problems we will observe, even though physician will take care of the prescribing in whenever there is a other case, whenever there is a methotrexate is not there, still sometime prescription we have seen where it is overlapped. So there are always, when you are taking a multiple drugs, we can expect pharmacodynamic interaction, pharmacokinetic interaction. Generally what is happening, many times when we are asked our students, whenever how you manage the pharmacodynamic interaction, so they will tell, take the two drugs apart. Dynamic means it is already in blood. You can't do anything. So only interaction with respect to the absorption we can prevent by spacing out. But rest you have to manage clinically, or you have to give proper justification for the patients how to use it. So there are certain methods which can be prevented by aparting the drugs. Something you can change the formulation also, it will be helpful. So that's why this HMR is one of the things which is require a vast knowledge for anybody who is providing that one. So particularly if you go to this thing, particularly if you say insulin, okay, insulin is one of the important drug which is require a highly monitoring. So patient who are on insulin, what you can say is there is a requirement of proper dosing has to be done half an hour before the food. This is a common instruction everyone will give. But meanwhile, there is a one more counseling session will be given where you should not take much rice. Especially this is very, very careful when you are giving a counseling to the patient, especially in the night time. So what is happening? You tell the patient to take a insulin and not to take the rice. What is going to happen? Generally, the sugar level will suddenly come down in the night, and patient may not be able to actually tell in the sleep whether he is having a symptoms of the hypoglycemia. So these are some of the challenging areas where you really require the home medication review. Then who can do it? That questions will come. Particularly the pharmacist is the better person. Particularly the people who is having a PharmD degree or postgraduates, definitely expected to be a potential candidate for your home medication review. Generally, whenever multiple medications you are taking, especially the most common problem is associated with these things are the side effects. It can be associated with the individual drugs. It can be associated with the drug-drug interaction. Sometimes what is happening, there are more than 10 drugs will be prescribed to a patient at a multiple point of time. But what is happening due to the interaction, the efficacy of the one drug will be nullified by the another. So in most of the cases, with the minimize identifying the such drug interactions, and we can minimize concentrating only on the important drugs, and thereby we can control the even diseases also. So that's why these clinical pharmacists are playing important role in the hospitals, because what is happening when there is a more than 3 to 4 BP drugs, blood pressure drugs are you're giving with the sugar medicines or oral hypoglycemic, definitely there is a expected that you can have a interactions in one or the other way. So particularly some drugs with the interaction, they will produce the arrhythmias. So this is a common challenge in the cardiology. When you putting the patient with the cardiac drugs, most of the drugs will have an heart beating. Suddenly there is an increases in the heartbeat. Complaints will directly comes. There is a patient was prescribed with drug and he is expected that he is having a heartbeat increases in the heartbeat. So when we go back, check that history, definitely there is a 2 drugs which will interacting and they will causes the arrhythmic type of thing, symptoms. So this way it is happening in the hospital. There are doctors are there. Suppose you same thing, if you proceed to the community level, what is happening? Sometimes patients are thinking that they are over smarts. Definitely. They will go to the even what we can call as our pharmacy. I have seen them asking. I was recently one pharmacy I was looking. He was suffering from some leg pain, which is having a little bit what we can call it as a wound type structure, and there is a what we can call it as it is infected. The community pharmacist, local pharmacist, I was there sitting, and I think so he was not feel to give him antibiotic good. So what he told is nearby doctor is there, you can go there and do that. But this patient, what is telling is, I know you give me ampicillin or some penicillin, which will be, he's told the name, particularly like amoxicillin is there, you give me that one. I will take it, 3 days you give, then I will see if it is not cured, then I will go to the doctor. See, like this, people are demanding and they are taking the antibiotics. Even when these pharmacists also giving, they never ask what drug he is on, whether he is what type of he is having any allergy, anything. They will most commonly the prescribing will be either your amoxicillin or some drug they will prescribe and they will give it. So this is results in particularly many type of what we can call it as an problems in the medication related problems, in particularly in the community settings. Hardly reported. Nobody knows what he took, what happened. So in particularly in the country like India, this is one of the major requirement which is usually needed. So steps are very simple. It is not big issues. Just to have to do the identify the patient who need. Generally, it is a polypharmacy who is on geriatric patient who is having on multiple drug therapies. Then you have to conduct a structured what we can call as a interview, which is to be needed to be executed. Then you have to have with the current medication list along with all the what we can call it as a both allopathy as well as the complementary alternative system. Identify the problems related to drugs, timing of medication, how he is taking, and precautions, give them what all the precautions they have to be followed. Then based on that, you have to develop a proper strategies and properly follow up with the general practitioner. So generally general practitioner and pharmacist will prepare the plan and they will explain the this thing, and finally the management plan will be explained by the pharmacist, and pharmacist will be the implement and follow up it. This is how general overall looking happening in a country like Australia. But in our country, there is only limited for as a academic activity, as he told. Sir told already, it is a one of the vital thing, but still it is only restricted to the teaching hospitals. Nobody will counsel. Counseling also like this. They will tell, take one morning, night, afternoon. They have written in the particularly that what we can call it as a sheet, and they will staple and they will give. Nobody will tell that you have to take it proper with, should be properly after food. You should take without what we can call it as a with milk, without milk. Nobody is going to advise anything. So most of the time what is happening, tetracycline will take with the milk and it will end with the malabsorptions or decreased in the absorption and resistance cases. So these are all the some problems which is commonly happening. And 90% of the whatever the readmissions are, they are all associated with the drug related problems. Anyhow, this is an HMR management plan. Actually, it is for the particularly how it is taking in the other countries. I'm not going to spend on this time. Just why HMR is required. What is this thing? When it is required, when there is a started with a new medicine, especially there is already number of medications are there. When you start with a new medication, it is a challenging really to the area, how to start, when to take, and how to identify any problems particularly associated with these medicines. This is particularly how to explain to the patient what is that medicine for, how to medicine will be helpful for you. You have to explain the patient how long you have to need to take, and what is the special instructions is required for when you are taking the medicines. Because what is happening when you take such medications, particularly it is associated with the either interactions or what we can call it as any new side effects. Patient may stop all the drugs together also. So that's why a special counseling is needed. Especially you go to the Manipal Hospital, Bangalore, where there is a special counselor is there for particularly for some special diseases. That is, they will guide the patients particularly until what we can call it as a patient will be on complete follow-up and other things. And this is now started as a new business also. I think so indigenous most of the companies are knowing, correct? What they have started is, they have started with a patient public one platform where Indigen is working through, other companies are working who is on clinical trial, especially on the medicines. They try to follow up the patients, giving a counseling, whether they are taking the medicine regularly, what all the side effects are there, anything problem associated with the medicine. This is to particularly why, because the companies don't want to lose their patients in between because of the potential drug interactions or the adverse effects. It is one of the way of marketing strategy that is nowadays, I think so, companies are opened, and it is through video conference only they are doing it. How I am able to give the lecture, through that they will try to communicate the patients, and through that they are trying to manage it. So this is one of the new marketing venture that is, I have seen recently HMR is proposed in the form of what we can call it as your medicine follow-up to the patient. Only idea is to this much only. Patient has to adhere to the medicine and he should not skip the medicine. Because now, till now, what is a thing is, most of the pharma companies are concentrated on the doctors, GPs or doctors. But now it is what is happening, the end users are also considered to be the important. This is one of the important area where I feel most of the companies in another 3 to 4 years, they will enter it. Because this is one of the thing which is definitely going to be challenging areas where really need the thing. Yeah, and when you are in a really hospital, definitely during the hospital setting, there is a lot of changes will be happening. Food in the hospital, home to the hospital, there will be a lot of differences are there. So you have to manage the patients. So in such condition, you definitely require the HMR, and particularly when there is a dose in the alteration in the dose, everything. So particularly this type of situation, you need a HMR. And definitely when you keep the track of the medicines, especially this HMR is also helpful for reminding the patients to go to the doctors, reminding with regular their patients to go for the checkup. So these are all the activities which is considered to be the sometime important. Some patients are asking, they will get the confusion with the number of tablets, colors, everything. So it was a one type of service where they will provide like a daily reminders also. So imagine that it's a vast area where we are taking care of your health. Such a type of things, it is a one of the good, what we can call as a potential area where definitely if anyone with a sound knowledge definitely can enter. So something he has to do, and something definitely there is a market is there. You say somebody, I will take care of your health. Why people are not coming? Definitely in this condition, nobody is taking care of anybody's health. If somebody tells, definitely they will come. But again, as I told, sound knowledge is important. Knowledge is make the lot of difference with you. I can't say by putting in the Google, this is answer I will get. No, it will never going to help. You should have a clear-cut idea what is happening, because for that, as I have seen sir also with this age also is doing lot of such activities. I'll really admire that one. See, even if it is what him is, just if it is a 10, even 100 people also he will conduct that much webinar. I was surprised. After that, he's telling every week I am conducting. Finally, what is this one is getting? He's at least to such type of knowledge promotions is definitely helpful for anyone who is budding pharmacist. Anyhow, it will be whether you are taking the medications properly, whether you are properly following the instructions of the doctors, especially insulin. Insulin is one challenging area. As I told, there are a lot of formulations are available. There is different types of syringes are available, 100 units, 40 units. So confusion to avoid. So papas, if it is that poor fellow from what we can call as village, he will go and ask, give me insulin syringe. He don't know 40 units or he don't know 100 units. Anything he get, finally end up with the hypoglycemia or something. Maybe he will fall down somewhere, and it is associated with some medical fracture and other things. It is associated with like that. So these are the things which is really need a challenges, and especially when you are concerned about your medications that is causing a potential harms, particularly as I told, like methotrexate, anti-cancer drugs, because anti-cancer drugs are one of the potential things which is regularly causing the side effects. So need to be help to the patient to improve their quality of life, which can be either altering the dose, or it can be providing some what we can call it as a physiotherapy type of things which will be helping to the patient. You cared for your more than one doctor? Yes, definitely. This is a challenging thing, and no one want to talk about other drug what other doctors prescribed. That's why I told a patient with a lady of Dubai prescribed with 3 different types of anti-proton pump inhibitor. Imagine that lady, she's taking from last 6 months.
Oh my God.
Imagine that what is going to be happen such ladies if it is taking the proton pump inhibitors regularly. So these all the things which is real. No, this is the real challenges what is happening. Even that KMC, when she came, she's not told to the doctors also. So they will also don't know. Suppose if that same consultant he has provided here, at least in the case sheets will be there, they will go through it. So it is the situation where even happening. So when you would like to know which if the medication has to be taken together, it is also important. Which medication you should avoid, which medication you have to take together, and what food you have to take with the drugs. These also plays very, very important role in your home medications. So I am not going to hear what is a home medication, and I am not going to tell you what is it and other things, but my thing is what is a potential problem to require to implement this system. And when you would like to advise, especially storing of the medication and disposing of the medication, this is very, very important. Storage, yes, insulin stored in a normal temperature is going to be happen anything. If you ask, nobody knows. Where to store, nobody knows. Whether it is to be stored in a sunlight, even our pharma graduate, if you ask, they will confuse what the next answer. So we have conducted one just one small survey where disposing, how you dispose the medicine. Medical store people don't know, patients anyhow they don't know. So what they told, we are going, no, there is on the way, there is a river is there, we'll pour that one. So this is the situation. We don't have anything with respect to the our system. That's why these all the things which is maybe helpful, because finally what is happening, that river is flowing and it will be come to the our place only where we'll drink the water. A part of the medicine will be there in that. So these are the situation which is going to be happening. And yeah, definitely barriers are there because of the lack of knowledge with the patients, even general practitioners. There is nobody knows that is what is to be done, how to be control over. And even if you want to ready also, they are not ready to accept. That is another problem. So probably these all these issues which is make our system to be not to adopt this system. But I think so in future it is maybe there is a change and it will definitely going to be take, because this insurance once it started leading, definitely they will have this such type of these things. And you have overcome, you know that one, that is a system has to change. Everyone has to accept, based on that only it will be possible. And informations I have already given to there. Go through that thing for your advice, whatever things are needed. You can communicate me at any time if it is needed, because I don't want to drag too much. The thing is only with limited time, I have to finish that one. I told that within 30 to 40 minutes, I'll try to finalize my lecture. So thank you for your that patience, whatever is there. But end of the thing, you always say, even my family also, when they are taking a medication, they will have a problem. My mother is always mixed with the Ayurveda with allopathy. I always tells, careful. No, she's never listened. Even we are there advising, she's never listened. So it is a potential problem everywhere. But balancing the things is very, very important when you particularly taking the medication. So this is a main, what we can call it as a challenges, especially in implementing the system. Yes. Thank you, sir.
Yeah, fantastic. Dr. Tunga sir, it was amazing. Personally, I loved the point which you made regarding the patient-centric marketing, which is gaining traction. Do you have additional thoughts on this point, patient-centric marketing, especially?
It's already one company we already proposed the plan, sir.
Can you elaborate without mentioning the company? Of course.
Yeah.
No, if you want, you can mention also.
No. I can mention. What has happened is there was my own friend. He's having a lot of problems for particularly discontinuing their brand.
Yes.
So he was proposing me like that. This is a major problem. We are doing it. What you are talking about? Always adherence and other things. How you can able to manage? Suppose if I am having like this problem. Then I told, just try to collect what are the reasons for failing your medicines, whether it's money, whether it is problems, then we observed that there is a lot of problems associated with the what we can call it as a counseling and follow-up. Maybe that is inappropriate. They have not mentioned the indications, particularly how to take and other things. That is the thing. Then I told them, just you start like this. Now, one project you give to our student, you can plan it. So what happened is there was I think so that time his manager came here. He was told, no, we will see that if we will implement as a pilot, then if it is something is working, we can think of that one. So I think so one product they have recently started. It is not long back. It is maybe by 2 months or 3 months back. In that they have started with for one their important molecule, that is antidiabetic, which is very costly. They don't want to lose the patient, so they have initiated with targeting the patients, and they will follow up regularly.
See, amazing. And I think that is also the power of Manipal, ladies and gentlemen. Manipal.edu, Manipal University is, the mecca of higher education, and you can definitely rely on their services. College of Pharmaceutical Sciences is one of the oldest in India, established in 1963. And it is also the #1 ranked. And today we had Dr. Girish Tunga sir, MPharm PhD, Assistant Professor Selection Grade, who is into pharmacy practice. As you can see, he is not only knee deep, he is neck deep into pharmacy practice. So much of passion he has for his subject. He has 8 years of teaching experience, 3 years experience as a hospital pharmacist. He has presented 45 research papers in reputed international and national conferences, authored 50 research publications in peer-reviewed journals, and 4 book chapters. He has received more than 5 travel grants, 5 Best Papers Awards, and conferences for scientific paper presentations. He is a reviewer for many reputed journals like PLOS, Human Experimental Toxicology, etc. He is very active in the training and placement assistance. He has coordinated 3 clinical trials. He is the secretary of Periodic Safety Update Report. You know, this is a part of pharmacovigilance, which goes up to Uppsala, which is in Europe. He has coordinated more than 3 workshops and 1 conference as an organizing secretary. He trains hospital pharmacists, healthcare professionals, including as a trainer for companies like Cipla, Pfizer, etc. He has got industry, academia, collaboration projects. He makes healthcare related softwares, and he is guiding doctoral students as well as PG students. Amazing, isn't it? He has got such a wonderful passion for his activities. Congratulations, Dr. Tunga sir, for doing such an amazing job. There are plenty of questions. Manoj, are you in a hurry?
No, sir, that's fine.
Okay, thank you. Manoj, we'll have 5 minutes Q&A if you don't mind.
Yes,
Shashidhara sir is here. I think it is Dr. Shashidhara sir, if you have seen the chat section, Manoj. So respects to Dr. Shashidhara sir. He is asking why PPR 2015 is not yet implemented, because it will definitely accentuate the role of pharmacist. Is it because there are a lot of risks associated with it? What is your understanding, Dr. Tunga sir?
It is implemented means who will implement? That's the thing.
Yes.
No, we are not implemented. It already came, results already came, but we are not taken any initiatives, correct?
Okay.
But nobody is doing that one. Nobody is doing the services actually. They have Service Pharmacy Practice Act has been came. It came actually giving a initiative for going and doing the counseling and other things. But still, that's why I already told. We are only restricted to academics. That's all. Our services nowhere recognized. Because not recognized because we are only doing for the academic activities. That's all. Nobody will go and initiate that thing, and nobody even, I feel there is a, but still I'm telling you that respect in the community pharmacy or community is there. When you say pharmacist, definitely they will tell you everything truth. I don't know what is that relationship, but I have observed that thing. Even they won't tell to anyone the truth, but they will come and tell you the truth.
Yes, the most accessible healthcare professional is the pharmacist, as per this.
Challenging issues are there because even what they have asked is also clear, because no clear cut fees, what to fees has to be collected, how to be collected, what is the thing, and moreover knowledge is definitely, we are not up to the mark what require. I think so maybe around 10% of the pharmacists may have the knowledge, but rest of them I don't think so they have enough knowledge. That is a thing. When you have a knowledge, definitely you will have an idea. That's how it is to be. And this is only required, you will learn with the patients only. You have to involve in the rounds. How many will, if you suppose so much PharmD colleges are there, I'm telling how many people are involved really in the clinical practice. Definitely there is a knowledge gap is there. Because of that one, even it is a, the rules will also comes, it will take some more time to implement.
So even if the opportunity is given, the candidate should have the capacity. That is what sir is saying. He should have the ability to execute the tasks. You're right, sir. And Sheikh wants to know, we can have a quick answer session in this. Can prophylactic or preventive drugs cause adverse drug reactions?
It may cause.
It may cause.
It may cause. If preventive prophylaxis, it may cause, because it is all how it is. It is there are different types of adverse drug reaction is there. One is called as an idiosyncratic reactions. Idiosyncratic reactions we cannot believe how it is. A ceftriaxone can be, or you can penicillin. Penicillin is allergy to someone. It may not be allergy to someone. So it depends upon the idiosyncratic. Suppose you any drug like that. Even we can't say that all the patients or all the persons will have a similar allergy. So even preventive or prophylaxis can cause the adverse drug reactions.
Okay, thank you. And the next question, Anup wants to know, if an anti-diabetic drug is giving normoglycemia in a patient, should that patient still see the doctor?
I didn't get.
See, there is a patient who is taking an anti-diabetic drug and the blood sugar is normal. Now, should that patient still see the doctor regularly? That is
Yes,
what
definitely. There is a 3 months follow-up is there. You have to go there because it is what is happening. Sugar level is not only the indicator of your well-being, because in what happened in even in a normal sugar, we have observed patient may get the diabetic complications called diabetic nephropathy and retinopathy in a longer duration of time, because what is happening is once it is a diabetes comes, your most probably even your full body, that metabolism or whatever pathway is changes. So even if the sugar level is normal, better to once in 3 months consultation will be the better, because because definitely they will tell no regular eye checkup, regular this thing. Why? Because we can't say sugar level will be maintained throughout the day proper only. There is a variation will be there. It is a body situation. It will changes. Yes.
Now, Pandey has just typed in, he wants to know whether diabetes and PCOS, is there any relation? Can diabetes cause PCOS? Polycystic ovarian syndrome. Any reports you are aware of?
No, not much. I don't think so. Yeah.
Okay. Then Rashmin wants to know, if you have multiple counselors, like doctor is also counseling, he goes to 2-3 pharmacists, then what about the complications? I mean, each guy will counsel in a different way, right?
Definitely. Actually, the issue is related to the counsel is regarding, see, if you go to the doctor, generally, I feel whatever the normal practice is, they will tell only the overview of the what you are taking.
Yes.
Community pharmacist, I have rarely seen they will counsel. They won't counsel. They won't counsel. No. Doctors will also counsel, but they will have minimum related things.
Yes.
Nobody, I think so. There is if you say to respect to the particularly the taking of medications, they will everyone will advise only that one, how to take, when to take. But other things nobody will concentrate. Only the over glimpse will give. And some of the general practitioner even don't have the time that much also.
In your experience, sir, will a pharmacist counsel better or a doctor? Or is it, generally speaking, have you any?
No. Medicine point of comes, definitely the pharmacist will be having a higher role.
Okay.
Definitely. But if you go to the psychology wise, doctor will be the better.
Doctor will be a better. What a brilliant answer. And Sheikh wants to know the difference between drug-drug interactions and drug-disease interactions. How do you distinguish between them?
Yeah, correct. This one, drug-drug interaction is associated with mainly associated with the mechanism. Suppose you say one drug is inhibiting the metabolism of others, or you can say one is activating the metabolism of the others. So it is a mechanism-related problems where here disease is mainly it is associated with the excretions or this one mainly excretion or metabolism. That is the thing.
Okay.
Definitely. Suppose if it is a patient is on a renal failure, the thing is what you can do is, suppose that such a type of disease drug interactions are there, you can reduce the dose and you can manage this thing, blood level. But when come to the drug interactions are there, it is difficult to control. Where disease drug interactions we can manage sometimes.
Oh, that is a very good insight, sir. And you tell that doctor also, community pharmacy is not counseling. Doctor is also not having the time to counsel. So I think patient-centric marketing will see a lot of traction if people are going to invest, because counseling needs are also met through patient-centric marketing. You were talking about
here. Mainly thing is it is not counseling is only important thing here.
Yes.
Here, what is the thing is your planning and you will monitoring them how to do it. Counsel you can give. Somebody asked that they will go counsel. Counsel is finally, it is not like that everything I today tell, they will carry on. It may not be needed. And what I would tell, it may not be enter that time, because what fraction of time you are giving to them, it may not be sufficient sometime, because I don't know what is a patient mindset that time. See, they will go to the different 10 departments And at the end of this, you see, they won't talk in any doctor. They will wait as much as possible. When suppose you imagine that he entered at 8:30, he will finish 3 departments and he will come to the pharmacy. He will start murmuring. When entering to the pharmacy, he will start murmuring. You give me my medicine. I am already late. So that time you tell him to counsel. He don't have a patience. He don't have a patience. And even in the doctors also, if you tell that one, because his mind is running somewhere else. There's a common practice in the hospital or anywhere you go. So this way, this home medication is what is the thing is, it is when you there, you will have a free time, you will identify and you will go. And it is a normal talk. When you talk to them to their level, no, the effect will be entirely different.
It is, in fact, you are creating a new employment opportunity, Dr. Tunga, sir. This HMR, home medication review, can turn out to be a very big, if the pharmacist is skilled and knowledgeable. It is a very interesting point you have made.
Definitely. It can be a convertible, but there is some initiation is needed. Maybe probably don't know. It can be a good, this one also. We don't know about that one. No, one more thing. Even that's why I told you should have a multiple diversity. You cannot concentrate only one thing. You should be able to fix the proper appointments with the GPs. You are able to monitor their health. It is a composite of a packing. It is a combi pack. With that only you have to work out.
And what about food-drug interactions? Shashidhara sir wants to know, because he's saying that this sort of data is not very easily available.
Yeah.
Food and drug.
Data are not easily available. But there are certain, if you go to the Medscape and WebMed like that, there are informations are available, particularly the certain foods which is commonly people are taking.
Okay.
So based on the drug, you can note down and you can tell that one. There is not much information available. What he told is correct.
Yes. Okay. Especially in Indian context and Indian type of diets, I think there is zero, very negligible.
But still, the informations are available now. It's available.
Okay.
There are good there are good databases like Micromedics. I think so. If they are a faculty, they know Micromedics and other things, drug databases. It is given. You just need a search on that one, you will get it.
Yeah. Sir, a lot of questions are pouring in. Basically, your talk has been, it appears, setting the, cat among the pigeons. It has really excited all the listeners. I will take only one last question from Sarah and then hand it over to Manoj. So, Sarah wants to know, after doing Pharm D, how to pursue further study? Is it a PhD?
Yeah, I think so. See, if it is a Manipal University, Manipal will call. I think so. Every university started calling for PhD. This one, you have to go to the respective universities and you have to apply for the PhDs. Maybe Manipal, either NITE, like that. Even I think so. KLE Belgaum also. They are whichever like Belgaum University, whichever is having a deemed university, or even RGHS also will calling. I feel you have to look at the university websites. They will Manipal is suppose if you say Manipal have a 2 times they will call for the PhD. In that they will give out these are the PhD topic from the each department.
I think JSS calls 4 times, right? JSS, I think it calls
every quarterly.
Every quarterly.
Okay. Yeah, we have actually 6 monthly it is there. So what is happening is every 6 monthly there is a call will be there. Each department wise they are allotting the PhD students. So I think so last time one was there. Before that one there was 6 PhD positions were there. Yes. So based on that, what we can call it, they can apply by looking the websites. It will be one in January it will come. One is in June it will come.
Okay.
So
fantastic.
Fine.
Yeah, it was fantastic. I mean, it was amazing and a lot of involvement of the listeners. Actually, Dr. Tunga sir, what I have seen, there are high quality listeners today. The profile has been changed from mass to class. So I now request Dr. Manoj ji to please take over. And he is, as you know, running his own entrepreneurial venture called Pharmapulse. And we have given a lot of these files for downloading. I request all the attendees to download. There are superb things, including shared by Dr. Girish sir, PSA guidelines, HMR2, home medication review 1, like that. Lot of interesting things are here. You can download all of them. It's all for you, ladies and gentlemen. Please do make
KRPA
use of
monthly
it.
bulletin, yeah.
Yeah, the KRPA October 2020 issue is also loaded onto the attendee. So that is our KRPA monthly bulletin. Please download that too. Yeah, Manoj, please take over.
Yeah. Good evening, all. Thank you, Dr. Girish, for that wonderful talk. As you rightly pointed out, pharmacists, they are the first point of contact and are the most accessible amongst all the healthcare providers, right? They can act as a barrier solver and also the, barrier remover, and can, create a wonderful situation in the patient care. Only if they are upgraded to the next level with the latest tools and technologies, and by upgrading their knowledge, right? The most important objective of HMR is that the patient becomes healthy, his her quality of life improves, and this could be done by our clinical pharmacists and the PharmD professionals who could play an important role in this. Pharmacists are leaders who provide noble service to the mankind through their patient-centric approach. And currently, this element of patient counseling is not widely accepted in India. And I hope the pharmacy professionals would take this as a challenge and come up with innovative solutions especially with the help of digital tools and technologies, and they can improve the overall patient satisfaction by improving their total quality of life. For this, the knowledge and access to technology is absolutely essential, because every single day we are coming up with new technologies that can help our pharmacy professionals do their job in a better way. And I shall be more than happy to connect with any of these pharmacy professionals who are in need of such a technology, or who want to develop their own technology stuffs for this in this regard, right? I would like to thank Group Pharma, especially Dr. Sunil Attawar sir and his team for the tech support. They have been helping us a lot in conducting this weekly webinars. KRP, under the able leadership of Dr. Kaushik, has played a key role in organizing this webinar series. Sunil sir, I have no words to thank you. Thank you so much for your support and your infectious energy that has been helping lots and lots of pharmacists gain that extra knowledge every single week. Thank you so much. Thank you.
Thank you very much, Manoj. That was very nice of you. Now we go over to Dr. Kaushik Devraju, President of KRPA. A nice, smiling, handsome man there. Yes, Dr. Kaushik.
Just wanted to say in the beginning, today is the World Mental Health Day. I think, you brought a lot of smile with all of graphical pictures and pictorial diagrams. I think, that made the session very lively to go ahead. And a lot of humorous things was also there in that. And Girish sir, I think you have spent a lot of time with us for sharing your knowledge. I think, a lot of good things were shared. I think a lot of practical aspects were shared. I think I think you have answered most of the queries that were asked by the attendees, and thank you very much, Girish sir, and hope to see you in many such programs. And also hear that you are one of the passionate teachers that drives. I think that is more happy to hear that, sir. I somewhere in the middle I saw one of my friend walking there and giving a headphone and went also. I think I forgot his name. He's my friend also. And thanks to Manoj sir. Manoj sir, you have been doing a very good work, whether in terms of digitalization, helping the pharmacists with the digitalization. I think keep up the good work, sir, and we are always with you for any type of collaboration, any work in the future to come, days to come. And thanks to Sunil Attawar sir for giving this wonderful platform to KRPA for conducting this such type of webinar to all the pharmacists and all the students. And all the teaching faculties are appreciating the webinars that we conduct. And thanks to one and all. Once again, thanks to Sunil sir, and thanks to all the attenders. Please do share your feedback. Please do write us any feedback is there, and if any queries is there. Thank you very much. Thanks one and all.
Thank you very much. Please join me, Manoj and Kaushik, to give a rousing hand to Dr. Girish Tunga sir. Thank you very much, Dr. Girish sir. Very, very kind of you to come today.
Thank you.
Thank you. So, I'll, with your permission, I will be closing today's event.
Yeah,
Yes?
yeah. Okay.
Thank you.
Fine. Thank you. Yes.